with the community action programs. We're working with the federally qualified health centers and helping them with information and outreach to those populations. But we're also working with, as I mentioned, the fishermen, the farmers, the artist community, doing something over at Pelican Labs for the co-working spaces and the artists next week, realtors next week. So different communities of people who have been largely self-insured, largely paying high deductibles, things that haven't been working for them in the past, and how they can look at things that might work better for them going forward. And to my point about us trying to make some changes in terms of how Maine healthcare is working, in April, there was a conference at Quality Counts. I don't know if some of you are familiar with that in Augusta, but health professionals coming together. And the theme this year was, how can Maine be the first state to achieve the triple aim, which is a national movement to do these three things. And they really need to be done in concert: to improve population health, to improve customer satisfaction, in this case, patient satisfaction with their care, and to reduce the total health care costs. So we see ourselves as part of that solution, the ways in which we want to incent people going forward to utilize their health care to make smart choices. And we, again, are working through the whole state. So we have outreach. I do York and Cumberland counties. I have 3 counterparts. One, actually, we are looking for someone in the northern part of the state. But we are doing outreach where our provider network is contracting hospitals across the entire state and providers across the entire state. So our approach is to be Maine-based and member-led. We talked about a number of these things. Our focus is really on prevention and primary care. We're integrating medical and behavioral health, leveraging local care management. Our Director of Care Management and Quality is focused on supporting local care coordination efforts. So she's out there talking to the community care teams, the patient-centered medical homes, and we're trying to be out where people are already doing really good local care management, really good primary care focus. And I mentioned working with the federally qualified health centers. And then focused on shared decision-making and member engagement. So creating awareness of all the treatment options for specific conditions. We'll be pushing information out to both the providers and the members about this Choosing Wisely website. I encourage you, if you're interested in how people choose and access their health care, it's a great site. It's got 50 different specialties where people can go on and really see what are the physicians or providers in various specialties, so oncology, pediatrics, internal medicine. What are they promoting as healthy practices and high-value services? And what are they suggesting you might want to think twice about? And Sage, you mentioned, or actually Adwij mentioned, back pain for artists, right? And back pain for all of us. People, I think, get sent for MRIs because that's what we're told to do. But and I have certainly, when we've been on, health plans for my kids that were no cost for an MRI, they went because they got hurt or an ankle injury. And was that an MRI really necessary, or was it a better use of healthcare resources to do some PT, to rest it, to see what else works? But this Choosing Wisely website will be pushing out a lot of this information to our providers, and we built our plans. Tobacco cessation, again, no surcharge for folks who say that they are tobacco users, multiple tries for tobacco cessation attempts, and emphasizing treatment over penalties. And then value-based insurance design. This is out of the University of Michigan. And the idea behind value-based insurance design is really encouraging the most effective medical treatments, again, some of that Choosing Wisely material, but also